Hi, my name is Sarah Manriquez, and I am a social worker in Kansas City, Kansas. I am going to talk a little bit about my clinical practice and how I tie that in with advocacy. I've been a practicing social worker for about 15 years, and I have my clinical license. I am licensed in both Kansas and Missouri to provide outpatient mental health services. I manage the outpatient mental health services for our Spanish speaking clients at a nonprofit organization in Kansas City, Kansas. So, the work that I do in Wyandotte County is really focusing on treatment of individuals suffering with anxiety, depression, some trauma disorders, and post traumatic stress disorder. I also work with individuals experiencing domestic violence, child abuse, sexual abuse. Uh, One of the things that I have really enjoyed about my direct practice is being able to connect what I do with my clients into a larger macro focus. I am working in Wyandotte County with several different coalitions in order to improve the outcomes of our clients. Now, on an individual basis, clients come into the office and receive therapy. But what we sometimes get stuck in is that the individual work can't move farther until we identify some of the social determining factors that are affecting the client situation. So, some of the things that I am addressing in the coalitions that I'm working with, first of all, is violence prevention. So, Wyandotte County has collaborated with several community partners to form the Wyandotte County Sexual Assault Prevention Coalition. And in that coalition, the focus is on trying to identify a prevention plan that can be adopted by the unified government, which is the health department and several other partners in the community, to be able to address some of the social determinants that impact violence. So that could be different things like making lighting better in the streets, having more accessible parks, making people just feel safe and connected in their community directly impacts their ability to overcome trauma and sexual violence, but also to prevent sexual violence. So I am in the business of treating people that have experienced sexual violence, but I would much rather be able to prevent it from happening to anyone than having to treat it. The second coalition that I am a part of is called the Latino Health for All Coalition, and we've been around for about 10 years. And the work that we do, we have focused on areas of improving health, outcomes, and access for the members and community of Wyandotte County, but also focusing on nutrition access to healthy foods and diabetes education, prevention programs, as well as access to parks for soccer leagues and walking trails and bike paths. So that coalition has been really successful over the past 10 years in collaborating with many, many partners. And it has been phenomenal to see the impact in the community. It is not only affecting individual families, but it is really making a difference in the community of Wyandotte County. Wyandotte County in the state of Kansas has been identified with the worst health outcomes in the state. Which is concerning and makes it a little bit more difficult to do the individual practice of therapy for clients who are experiencing those secondary issues. So if someone doesn't have access to food, adequate housing, they don't feel safe in their community, they don't feel connected to the authorities that would be able to protect them, then they're most likely not going to seek out the higher level services of individual therapy. We also experience a lot of clients who are dealing with trauma, and I think it's directly related to what kind of determinants are happening in their county. So that could be related to what we are using is called the ACE, Adverse Childhood Experiences. And in Wyandotte County, we found that the majority of individuals in Wyandotte County have at least 4 to 5 ACEs, if not more, which is fairly high. And so a lot of community partners are coming together in order to try and change the factors that might be impacting people's ACE scores. So I certainly think that policy and advocacy work is a fundamental part of social work practice. And I think that it ties well into direct practice work of therapy because the stories that we hear, the experiences of our clients can be channeled into the work that we do in the community to really make a difference on a larger scale and try to reduce the impact for more and more people in the community. Thank you.